Good afternoon, everybody. I'm Kitty Marx, Director of the CMS Division of Tribal Affairs. And then on today's call, we're going to go over the Division of Tribal Affairs National Outreach Campaign. We're going to talk about ACA outreach materials that one of our contractors, Kaufman and Associates, KAI, has developed for us. We're also going to talk about other CMS outreach activities, and then the website that we've established for the Administration for Children and Families. And last but not least, we will talk about how to order the tribal products. In 2012, CMS held focus groups to test American Indian Alaska Native knowledge about the Affordable Care Act and to obtain feedback on outreach materials. And we found at that time that there was a low to moderate knowledge about the ACA, but in developing materials, the people in the focus groups recommended that we develop materials that had a strong identification of American Indian Alaska Native symbols, colors, and designs, and that the images of the individuals or families that we use in our outreach materials should be American Indians and Alaska Natives, and that the messages should be clear and to the point. And based on this research and audience testing, CMS entered into a contract with Kaufman and Associates to develop material centered on 4 major themes. And these themes are a new path to health care, peace of mind, get in the game, and communities need healthy men. And the last 2 themes were developed because of the new opportunities under the Affordable Care Act for states to expand Medicaid up to 133% of federal poverty level. And for the first time, childless adults would potentially be eligible for Medicaid, including many of the American Indian Alaska Native men in our communities, ages 19 to age 64. Using these themes, KAI developed posters, 30-second radio, public service announcements, and billboards. And in 2012 and 2013, these PSAs ran on over 80 tribal radio stations and could be found on over 325 billboards that were posted throughout Indian country. Okay. This is an example of one of the posters that we developed, A New Path to Health Care. And this poster shows that for the first time, Native families can have affordable care available to them, but at the same time, they can continue to get services from the Indian Health Service, tribal, and urban Indian health programs. In 2013-2014, KAI will continue its work on the Indian-specific media outreach to increase awareness and understanding of options through the insurance marketplace. And the outreach campaign will focus on drop-in newspaper articles, grassroots engagement such as attendance at conferences and tribal events such as powwows and basketball tournaments and such, public service announcements, and a waiting room video. So let me just take a few minutes to go over some of these specific campaigns. The next slide that you see will show the monthly drop-in news ads. This is an example that ran in October in 5 tribal newspapers: Indian Country Today, Navajo Times, Juneau Empire, Cherokee Observer, and the Seminole Tribune. And this article reached over 87,000 readers. Later on in our webinar, Bonnie will talk to you about how you can access these tribal newspaper articles that you should feel free to download from our website so that you can run them perhaps in your local tribal newspaper. And let me go through the next article. It's called Peace of Mind. And this is just continuing our theme. Each of the articles focuses on a specific subject matter just to keep people aware of the Affordable Care Act and what it means for them. So I'll go to the next slide, which talks about get in the game, which is another theme that we've been encouraging in tribal communities, and with the focus, again, of young men who may not have had an opportunity to enroll in Medicaid before, or may be eligible for insurance through the marketplace for the first time. So these are just different themes to get people interested, and again to raise awareness about the Affordable Care Act. In 2013, KAI helped us in providing a lot of these outreach materials at the NIHB Annual Consumer Conference in August of 2013, and more recently they attended the Dakota National Basketball Tournament in December. And then in January 2014, we talking about if a person already has IHS, why do they need health insurance? And throughout our outreach materials, we want to just remind people that Affordable Care Act, the health insurance marketplace, and Medicaid expansion is not a substitute for the Indian Health Service programs. IHS, the tribal programs, the urban programs will continue to operate. It's just by enrolling in these new health insurance coverage options, you can get services that perhaps your local IHS tribal or urban program can't provide or wouldn't have the funding to. It is a discretionary funded program, and sometimes funds such as the contract health service funding does run out, and by signing up for these programs, American Indian Alaska Native people have additional opportunities for coverage. That's why by enrolling in the health insurance marketplace or Medicaid expansion, you could get services that perhaps your local IHS tribal clinic is not able to provide. And in addition, if you choose not to buy health insurance, we do want to remind you that as a member of a tribe, you are exempt from the hardship, well, from the shared responsibility payments, and the Secretary issued a hardship exemption for American Indians, Alaska Natives that are eligible for services from the IHS, that they can apply for hardship exemption. And we hope to have a webinar on the hardship exemption in the next month or so. So look for more information there. The next slide talks about the public service announcements, and these public service announcements are 30-second radio clips that are similar to the drop-in news articles that I just referenced. And the PSAs have been recorded in 5 native languages: English, Navajo, Lakota, Ojibwe, Yupik, and Inupiat. Sorry about that. And they have been broadcast on such radio stations in Window Rock, Pine Ridge, Bellport, and through the Konak Broadcasting Corporation that covers Native Voice One, Native American Calling, and Earth Song. So we are estimating that over 96,000 people are hearing these radio broadcasts each week. And at this time, I'd like to have you all listen to a sample of our latest audio PSAs. Would you go ahead? And this one will be
1-800-318-2596. Get in the game.
Okay, and that's just a sampling of those PSAs, and that was the Navajo Mail. And again, these radio PSAs have been posted on our website as well if you want to download them. So at this point, we're going to go ahead and have you all view a waiting room video.
Hello, my name is Hattie Hoffman, and I'd like to talk to you about some very big changes in our nation's healthcare system and what it means for us as American Indian and Alaska Native people. The Affordable Care Act, which became law in 2010, opened the door to health insurance coverage by expanding Medicaid and providing free or low-cost insurance options for millions of Americans, including you and your family. Under the Affordable Care Act, American Indians and Alaska Natives can get free or low-cost health insurance. This insurance can be used at your local tribal, urban Indian, or Indian Health Service clinic or hospital, or at any other qualified health provider in your community. What's new is that when you enroll in a health insurance plan through the health insurance marketplace, you can still get services from the Indian Health Service, tribal health programs, or urban Indian health programs. Plus, your insurance will pay additional services your clinic can't provide or are not offered by your local clinic, but you need for good health. Application for enrollment begins in October 2013 with coverage starting January 1st, 2014. You can apply online. There are trained staff and online instructions to help you with the application process. If you need help filling out the application, there are special assisters to help you, so just ask at your local clinic. With health insurance coverage comes peace of mind. Knowing you have health insurance coverage will reassure you whatever arises. Necessary surgery, hospitalization, or referral to a specialist, you are covered. This is a big change. No more waiting on a medical priority list to cover special care. You will be covered. If you're American Indian or Alaska Native eligible to receive medical care through IHS, tribal clinics, or urban Indian health organizations, you can have certain benefits and protections, including no deductibles or co-payments if you continue to use your IHS, tribal, or urban Indian health program. No premiums, enrollment fees if you are eligible to use an Indian health or urban Indian program, and no deductibles or co-pays for Medicaid. No out-of-pocket expenses if you are enrolled in the Children's Health Insurance Program, CHIP. You will not be assessed a tax penalty by the IRS if you do not have health insurance. Plus, if you're an enrolled member of a federally recognized tribe, you have benefits in addition to the ones I just mentioned, including no deductibles or co-payments if your household income is below certain limits, $70,650 for a family of 4 in the lower 48 states, or $88,320 for a family of 4 in Alaska. And you can enroll during any month of the year instead of waiting for an annual enrollment period. In addition to the special provisions offered to American Indians and Alaska Natives, our people are also covered by the basic benefits of the Affordable Care Act that apply to all U.S. citizens. This means you can't be denied coverage because of a pre-existing condition. There's no lifetime limit on how much care is paid for if you get sick. Your coverage can't be canceled if you get a serious illness. And preventive health care is covered, like mammograms, flu and pneumonia shots, and well child visits from birth to age 21. The Affordable Care Act honors our unique trust relationship with the federal government as Indian tribes and Indian people. Special provisions continue so that certain payment from Indian land or treaty rights and money from the sales of items of cultural or traditional significance won't be counted for determining Medicaid or CHIP eligibility. So, how do you apply? Starting in October, you can fill out an application on healthcare.gov or by telephone, or you can ask your local clinic or hospital to help you fill out a paper application. Your information will remain confidential. There is a special section on the application just for American Indians and Alaska Natives. To take advantage of the special benefits and protections, you must fill out the full form and the section for American Indians and Alaska Natives. Whether you're an enrolled member of a federally recognized tribe or a non-enrolled descendant of a tribe eligible for IHS, tribal, or urban Indian health care, you may qualify for these special benefits and protections, but you must apply. On the application, you will be asked Social Security numbers for you and others applying for coverage, employment or income records, information about current health insurance, including information about employer health coverage. If you are enrolled in a federally recognized tribe, if you have ever received health services at an IHS, tribal, or urban Indian health clinic. How much income you receive from Indian land, natural resources, and items of cultural or traditional significance. This information is needed so that these types of income are not counted against your eligibility for Medicaid or CHIP. When you enroll in this new free or low-cost health coverage, you'll have the peace of mind knowing you are covered. Also, your IHS, tribal, or urban health program will be able to bill your insurance, bringing in much-needed resources for our community's health programs. When you need to see a specialist, you will be referred to one, and you will not have to wait to see if there are contract health service or CHS dollars available or replaced on a CHS waiting list. Our American Indian and Alaska Native communities have done a lot with very little for a long time. We've worked hard to protect the federal trust responsibility to provide health care to our people. Now many more of our young, old, married, single, employed, unemployed, those with children, and those without children have health insurance options. Our people, including you, deserve the best coverage available. So protect yourself, protect your family, protect your people. Ask about applying to the health insurance marketplace today. To learn more about the health insurance options available under the Affordable Care Act, Medicaid, and CHIP, go to www.healthcare.gov or ask your clinic provider or business office for an application. If you will need assistance filling out the application, please contact CMS at 1-800-318-2596 to get the additional assistance needed. If you are a TTY user, please call 1-855-889-4325. We want to make sure no one misses out on gaining access to this insurance opportunity.
Okay, and now we're going to talk about briefly some additional outreach materials that CMS has developed, and these are 60-second or 30-second public service announcements. And working with one of our contractors, these will be shown in the IHS and tribal waiting rooms through a Good Health TV network. And each of these PSAs have been modified to reflect specific information about particular states. So why don't we go ahead and listen to the video from South Dakota.
The main thing we provide as a nation, and is a priority, is the health of our youth. They're precious, they're gifts. They're gifts from the Creator. It wasn't until my daughter got sick that I became aware of the CHIP Medicaid program, the Children's Health Insurance Program. As a Native American, our children are eligible for the CHIP Medicaid program. With CHIP, our children have access to more services than ever before. But first, they have to be enrolled in the program. Being involved in the CHIP program gives us extra opportunities or options to make sure that my children stay healthy. The CHIP Medicaid Health Program benefits the children of your community and your nation. Our children are our future, and we need to have them healthy. Visit our website or call the number below to find out how to enroll your child in the CHIP Medicaid program.
Okay, and there you can see where you can get specific information about South Dakota's Medicaid and CHIP program. And now we'll go ahead and view the public service announcement, which has specific information about how you can find out more information about California. Go ahead.
Our young people love to play sports, and so we as a nation and the health system work hard to promote the health of our youth. The CHIP Medicaid program benefits the children of your community and your nation. It wasn't until my daughter got sick that I became aware of the CHIP Medicaid program, the Children's Health Insurance Program. As a Native American, our children are eligible for the CHIP Medicaid program. With CHIP, our children have access to more services than ever before, but first they have to be enrolled in the program. Being involved in the CHIP program gives us extra opportunities or options to make sure that my children stay healthy.
We're healthy. Make sure your family stays healthy.
Enroll your children in CHIP Medicaid health program so they can stay healthy too. Get your child in the same today.
Visit our website or call the number below to find out how to enroll your child in the CHIP Medicaid program.
Okay, and as I indicated before, the CMS Division of Tribal Affairs website is located on cms.gov. Once you're on cms.gov, you'll see a webpage that says Outreach and Education. You click on that, and then you can click on American Indian, Alaska Native, and then once you get to that page, you can scroll down and click on Outreach Materials, and you'll be able to find all the materials that we've talked about today, and Bonnie will talk a little bit more about that. But why don't we go ahead and talk about the ACF Tribal Health website. Beth?
Hello, I'm Beverly Lofton, and I also work here at CMS in the Division of Tribal Affairs. The slide that you're looking at now is a screenshot of the general information page for the Healthy Tribes website. The website is managed by Outreach Process Partners, OPP. CMS Tribal Affairs works with OPP through an intra-agency agreement with the Administration for Children and Families, ACF. The intra-agency agreement is in place from September 2013 through the end of May 2014 to perform the outreach and coordination activities for CMS and ACF partners. The Healthy Tribes website is intended to be a resource and discussion platform for all things related to American Indian and Alaskan Native human services and healthcare. OPP will host several webinars for CMS Tribal Affairs from now until the end of May. Topics will include information related to health insurance services available through CMS that are specific to American Indians and Alaskan Natives. To date, OPE held an Indian Health 101 webinar for CMS on December 9, 2013, and a webinar on the Affordable Care Act 101 for American Indian and Alaskan Natives. And of course, OPP is hosting today's webinar. If you would like to register for these events, please go to the Healthy Tribes website at healthy-tribes.org. Registration information is on the main page under Information and Updates. In addition, OPP will work closely with CMS exhibit booth coverage for many upcoming tribal conferences that will focus on human and health services. Thank you, and I'm going to hand it over to my colleague, Bonnie Hillsberg, to go over our website and a little bit more about how to order outreach materials.
Good afternoon, everyone. My name is Bonnie Hillsberg, and I'm also with the Division of Tribal Affairs. And today, I will be speaking to you about how to order all the great resources come to CMS, Division of Tribal Affairs, and this will bring you to the website, or more commonly known as POW, can be accessed on the CMS American Indian Alaska Native website. When you go to the CMS.gov website, you'll click on the right tab, the very right tab, which is Outreach and Education, and then you will go to the American Indian Alaska Native tab on the left-hand side. Scroll down the left navigation bar and you will see the How to Order Tribal Product page. Click on that and it will bring you to the screenshot that you are now looking at. If this is your first time ordering, click on the highlighted URL, which is http://productordering.cms.hhs.gov. From there, you will fill out the information. You'll select your new username and your password, and you're good to go. If you've already signed up and are a partner, then all you have to do is sign in with your username and password. And on this page, you will find a list of products with a product number. This list is updated monthly as new products are developed and old ones are archived. Here's a few tips. There is no charge. These products are all free. And if you're ordering and you need the products by a special date, please give the CMS warehouse at least a 48-hour notice so they can prepare and ship the order in time for you. And last but not least, I would like to encourage you to go to the CMS.gov website. There are a vast amount of resources on this website, and they're all available to you.
If you take the time and you look through the website, you will find amazing information on long-term support and services. There's a great roadmap with all kinds of resources. There's the Children's Health Insurance Program. There's the Affordable Care Act, state tribal relations on health care, tribal consultation, upcoming trainings, webinars, all tribes and more. So I would encourage you to surf the website. Thank you and have a good day.